We've got Amy Brewer, who's a health educator with our population health team, talking about vape designs and tactics and tricking kids. So without further ado, Amy, I'll let you take it away.
Thank you. Thanks, Kate. And thank you all for joining me. I can no longer see your faces, and so I'm just looking at my presentation. So if you choose to make faces at me, I will not see them. So feel free, go for it. So as Kate said, my name is Amy Brewer. I am a health educator at Northwestern Medical Center, and I also coordinate the Franklin Grand Isle Tobacco Prevention Coalition. And what I've been doing for the past bunch of years in spades is really talking about vapes. Kids are interested in them. They are popping up in schools. Schools are dealing with them. Parents are dealing with them. And I wanted to give anybody who was interested a bit of information about them. So what I want to do is not just talk about what they are and what we think that they do to our bodies, but also help you all understand how the companies are really influencing our youth in a very specific way. Um, so I'm going to give you a little overview of what you need, what I think you need to know, and how you can help youth navigate. So that's kind of the angle I'm taking. Um, but not advancing. Hold on. There we go. So here in my presentation, these are the three things that I hope to accomplish today. I want to talk about what we know about the products, and I'm going to do that in just 2 quick slides, just an overview. A majority of what I want to talk about is why on earth students are interested in these products. And then I want to end by giving you some information that we can all use to help youth stay healthy and safe now and into the future. Okay, you're going to see I put a lot of pictures in. I want you to see the products. I want you to get a sense of how varied they are, how colorful they are, just an understanding of what they look like. So generally speaking, these pictures here on the right are pretty normal of what they might look like. Colorful, sleek. Um, they're about the size of a thumb drive, or a small pen or a lipstick case, right? They're not big. The ones on the left here have been kind of confiscated by the FDA, the Food and Drug Administration, not confiscated, but those companies have gotten in trouble because those are very youth focused looking um, items. They have youth cartoon characters. They maybe some of them are shaped like popsicles, or if you're old enough, a Game Boy, a variety of different things that are very toy-like. Okay, so here's the technical stuff. It's I like when I'm talking to students to really break it down to what are the similarities between cigarettes and vapes, because we all have a great understanding of cigarettes. We all know what they are, what they do to our bodies. We have 100 years of data, right? So this is generally where I talk about it. Both cigarettes and most vapes contain nicotine and are therefore addictive, right? So it's the nicotine that keeps us coming back over and over again. We know that both cigarettes and vapes affect our immune response. They increase our risk for COVID. They increase risk for respiratory infection or other respiratory problems. We know that short and long term, they do cause harm to our lungs, although the harms that they cause are different. We know that both contain cancer-causing chemicals, the carcinogens. Cigarettes have a ton of cancer-causing chemicals in them. Vapes don't have as many, but vapes still have cancer-causing chemicals in them. Both cigarettes and vapes are legal only for those 21 years old and older. In Vermont, they are legal to use in indoor public spaces. Neither can be shipped in the mail to Vermont or within Vermont. And the Food and Drug Administration has authority over both, although it exercises it in different ways. Now, some of the differences is that we've known since the 1960s that cigarettes cause cancer, and not just lung cancer, they cause about 12 different types of cancer. We know that cigarettes cause heart disease. We know that cigarettes cause death. We know that part of the challenge with cigarettes is that they're burned. And anytime you burn something and take in the smoke into your lungs, you are taking in carcinogens and other harmful chemicals. And it could be standing over a fire pit or, anything you might burn and take into your lungs. Cigarettes are unique in that you burn them 20 times a day and take that into your lungs. So the exposure is quite great. Cigarettes contain tar. That's the black stuff that gets stuck into an individual's lungs. It's sticky. Vapes don't have tar in them. Cigarettes can only be created in tobacco and menthol flavored. All the other flavors were banned because they were found to appeal to kids. There are marketing restrictions. You don't find cigarettes advertised on TV like you would beer, and a variety of other restrictions. And we know they've been mass produced for over 100 years, right? So we have a lot of information about them. Vapes, on the other hand, are heated with a battery. And because they're not burned, they have those fewer carcinogens, but still have them. We know that what is pulled into your lungs and sent out into the world contains metals, like tin, nickel, aluminum. And those metals come from the battery and the coil mechanism, right? So it doesn't matter whether there's nicotine in them or not. Those just using the device offers you an exposure to those types of metals. We know that there's other chemicals that come from the liquid and the flavorings. We'll talk about this in a second, but there's mostly no flavor restrictions. There are limited marketing restrictions, but we do know that vapes have caused hospitalization and deaths, right? In 2019, there was EVALI, which is electronic cigarette or vaping associated lung illness, and that caused illness and death among young people. And we know they've probably been around for about 15 years. So some similarities, some important differences. Okay, so I want to talk a little bit about nicotine because I find youth to be particularly confused about nicotine. We'll talk about it, why that's important. So nicotine is not safe for the developing brain, and that's because a young person's brain continues to develop until about the age of 25, more or less, right? When you expose it to nicotine, it can harm parts of the brain that control attention, learning, mood, and impulse control. Those are all things we want teens to get better at. We do not want to expose them to something that's going to interfere with that. And then a little bit more specific, each time a new memory is created or a new skill is learned, those stronger connections are built between the brain cells. But nicotine interferes. It changes that. And when I'm talking to young people and adults, what I say is we want our young people to reach their maximum potential. I put a helmet on my kiddos. I read to them. I want them to reach their full brain potential. Exposing it to substances, alcohol, nicotine, THC from marijuana, all interfere with that. And it has also been shown that using nicotine in adolescence increases the risk for future addiction, both to nicotine and other substances. You are paving the way for, exposure to alcohol or THC later on might be more likely to become addicted, right? So those things are related. You are kind of paving the way for easier addiction. That's kind of my technical stuff. I'll pause. If anybody has a question, feel free just to unmute. Otherwise, we'll get a little bit more into the tactics.
Amy, I've got one.
Sure.
And you might be gonna cover this later, but I'm just wondering about like amount of nicotine in vapes as compared to a cigarette.
Yeah, that question comes up, and that's I don't have an answer to that because vapes, in some countries, they've said vapes can come in like 3 milligram or 5 milligram and not more. US is Wild West. There's no limits, and how you use them varies. So your exposure to nicotine is not terribly comparable to your exposure using a cigarette. That's it. I don't have a good answer for that. Lisa, did you have a question?
Yeah, and you might get into this too. What about these? I guess there's new nicotine-free vapes. Are those any better or?
So yeah, we'll talk a little bit about that, and I want to talk about the role of nicotine, but the answer is regardless of whether there's nicotine, you are exposing yourself to chemicals and metals by the vapes and the flavorings themselves. The long-term effects of those are unknown. If there's zero nicotine, your addiction level is lower, except some studies have shown some zero nicotine vapes still have nicotine in them, right? When I say Wild West, it is a little Wild Westy. So non-nicotine is not safe. Non-nicotine isn't necessarily nicotine free, but the long-term effect of using a substance that you're not addicted to that contains metals and other chemicals is unknown. Does that
Okay,
help?
I do. Yeah, I have some kiddos that are trying to quit and they're like, "Oh, I'll just try this." And I'm feeling my gut feeling is like that doesn't seem safe either. So
Trust your
just
feeling,
wanted
Lisa. Yep.
okay.
I can't quantify how risky it is, but I can tell you it's not safe. Okay, here we go. I want to explore a little bit about why on earth kids are using them, right? So here's things, and we're going to go through them. And again, I'm trying to put some pictures in there for you to see. So they're flavored, they're electronic, they're personalizable. Um, Peers and influences online and social media are promoting them. There's a misperception, and I'm going to go through these. There's a misperception that they help with stress, or that THC helps with stress. They're easy to hide, pass, and share, although that's part of the COVID risk right there. And then the industry uses its same old tactics that they're sexy, they're healthy, they're intriguing, and then THC is its own category. And this is a picture from a website, and you can't see it very well, perhaps, but there's a young person smoking behind a chain link fence. And my question to you is, why is a over 21-year-old behind a chain link fence, right? And I would posit that perhaps that she's meant to be a student at a schoolyard. So some technical stuff, and I'll kind of go through this fast. Flavors are very popular. They're fruity, they're mint, they're menthol. If you look at it, fruit and menthol have been wildly popular since they started. Some data from the National Youth Tobacco Survey, more than 2.5 million nationally, high school students, high school and middle school students are using vapes. More than 1 in 4 are using them daily. So it's about 25%. Mostly currently they're using disposable, and I'll tell you why in a second. And almost all of them are flavored. Okay. Although 25% is an alarming number of our students to be regularly using a substance, keep in mind that 75% of them are not. So it's still more kids are not than are. Um, this is busy, but really what I want to talk to you about is right here where there's a dip and a change in the color. Is the national government said, because Juul was wildly popular as a brand, they said no more mint flavored, and no more creamy brulee, no more cucumber. And so there was a change. The mint went away, but it didn't change the number of vapes being used. And you can kind of see that a little bit here. What the federal government did is say pre-filled cartridges like Juul, you guys can't have flavored stuff anymore because that's what kids are using. What they didn't do is apply the law to disposable vapes, which weren't very popular until that moment in time. And now they're wildly popular and still flavored. Okay. As expected, youth go where there's least resistance. So if they couldn't get what they were originally getting, but there's another opportunity for them to get a new device, they'll go there. They're not brand specific. We also know that electronics appeal to youth, right? They're in an age of not going anywhere without the phone. They touch their phone, they think about their phone, they use it for everything. Electronics are their thing. These products are sleek, they're customizable. You can get these little wraps that go on, you can order your own. Some of them are engravable. They are colorful. And I would also share with you that they're instantaneous, right? So if you can think of someone, whether you used to be a smoker or are a smoker or know someone who was, to use a cigarette is smelly, it's harsh, it's hard to use. Everyone knows you're using it, right? And it's not, you don't just take one puff and you're done. These are the opposite. You can take one puff, it doesn't smell particularly bad. As soon as your puff is done, you can put it back in your pocket, right? There's no fire to put out or anything like that. So all of those things make it very easy, very appealing, and very, yeah, very easy. When you look at some ads, excuse the phone, I am at my dad's house and I don't know how to make that stop, so I'm going to keep going. When you look at these are the official ads on the left, but also youth use memes. So they may be seeing these young, clean, bright ads, but they'll take their own messages and put them on a meme and share that as well. And so you see SpongeBob, I think his name is Patrick, although I'm not a huge fan, and all other people, jokes about using it in the bathroom, or pet memes, Elmo, right? Youth doing what they do best, which is create something interesting, but it also helps spread the word. You'll also see youth using social media to advertise. I used to think that it was the companies directly advertising, but it's not necessarily. So there's TikToks, there's tricks, and that you'll see this, what I circled is this person said, if you purchase something after clicking on this link, I'll probably earn a few bucks from the company, right? There's incentives for youth to use these, thinking that they'll get some free product. I found a lot of YouTubes or TikToks of kids sitting in their car using products or talking about products. Kids are on TikTok and YouTube a lot. So these are really spaces where these things are popping up. This one says, thank you for your support. Can we send you a box of our unreleased flavors? Right. So here's Puff Bar, which is a brand, commenting on this individual's kind of endorsement, right? And then here's just, you can also, kind of hashtag, when you pull up a hashtag, you can see different things and you'll see that they're using color and tricks and just individuals using. And I found a million ads of young women posed in a variety of really sexualized way, promoting the product. Okay, so those are all different techniques that the industry is using. They're also really, when I talk to kids, I hear stress relief constantly. These products will help me with my depression, anxiety, or stress. And you wonder why they think that, right? It's a stimulant. It's not a depressant. And part of it is marketing. Part of it is taking deep breaths. Part of it is what young people really don't understand is if you are addicted, you're actually relieving your withdrawal symptoms. And withdrawal symptoms frequently feel like stress, right? But here, if you're suffering from insomnia, vape before you go to bed is their message here. Beautiful ads that are really calming, right? And we wonder why youth are getting the message that these are they are decreasing stress. And we know that actually withdrawal is actually a feeling of stress. I talked about nicotine before. The company really, in this ad, talked about none of the studies and research done by private and government agencies prove the link of nicotine to cause cancer. Nicotine never was posed to cause cancer. It's the other chemicals and carcinogens in these products that cause cancer. Nicotine just causes addiction. It keeps you coming back, exposing yourself to those. But the companies really exploit that message. This is something that young people universally don't understand. I've been talking to them all year. This they don't understand. So it's one of the things that I've been promoting. Nicotine doesn't cause cancer. Nicotine free, Lisa, this is what you're talking about, nicotine free. The companies really help make that link, nicotine free, smoke healthy, okay? That's not fair, right? We don't know that nicotine is healthy. Non-nicotine products are healthy. We know a lot of those chemicals are in there, and we don't know the long-term effects of them on our body, right? Okay. I'm realizing I'm running out of time, so I talk too much. One device, multiple substances, right? We also are seeing youth using marijuana or pot or weed or THC, whatever you'd like to call it, in great quantities. So we know, according to the 2021 Youth Risk Behavior Survey of Vermont high school students, that almost 20% of our students used marijuana in the past 30 days. That's more than used any form of tobacco in the last 30 days. Vaping is a growing way that people are using that. Yes, Kate.
Yeah, sorry to stop you, but I mean, recently was hearing about this THC and vape devices, which freaks me out a little bit. And this is a really ignorant question, but is that the kind of thing you have to have a refillable one to put THC in? Or can you purchase, do you know what I mean?
Yes, you can purchase the liquid and have it be refillable, or you can go on YouTube and find the hack that shows you how to do it from a pre-filled cartridge. You can refill a pre-filled, right? YouTube will tell you how to do that. YouTube,
Right,
young people who use it will tell you how to do it.
right. Thank you.
So yes, so lots of cannabis use, growing number of them are using it in a vape device. We know neither is safe for an adolescent developing brain. And I would also say that you think THC relieves stress, anxiety, and depression. And we know that at best, for an adolescent, that information, that research is mixed. We also know that in certain circumstances, it causes depression and anxiety. So we certainly want to refer young people to appropriate means to handle their stress, anxiety, and depression, whether it's working with a medical provider or a healthcare provider or counselor or whatever. You can just see that the growing number of them are using it to vape. Okay. Moving along, because we're running out of time, one of the things I want to leave you with is, should you encounter a young person who is vaping, regardless of the substance, but mostly, nicotine, what we want to do, what our role is to help interrupt that transition to lifelong addiction, right? We want to make sure that if they sampled, that they're able to stop and not spend their money and their time and their bodies um, with that substance. So Vermont does have the equivalent of 802 quits for young people. It's called My Life, My Quit. Young people can text, they can call. Adults in our area can go online. There's lots of information for adults there as well, as far as helping our young people. It's not the only resource. We have the Truth Initiative has This Is Quitting. And then I want to remind people that, adults around kids are there to help as well. School nurses, health teachers, guidance, principals, pediatricians, parents. So lots of resources. Yes, Lisa.
Can you just go back to the slide so I can get the phone number for My Life, My Quit? Is that what it's called? Yeah.
Yes.
Thank you.
Yep.
Amy, how the process of quitting vaping, how does that compare to the process of quitting smoking?
It should be similar, right? Nicotine addiction is nicotine addiction. What is slightly different is it is hard to quantify how much a vape user uses, right? It's easy to say, I smoke a pack a day. I smoke a cigarette in the morning, a cigarette when I'm driving. Those things are easier to quantify. It is harder to quantify. I take a puff here. I take a puff here. It's hard to know exactly how much a vape user uses as far as nicotine, but understanding how to avoid triggers, understanding how to relieve your own stress, get through an urge, handle social situations, those things are all very, very similar. Okay. And then the last thing is just this. So I am certainly, that was really fast. It was faster than I thought. And I really just wanted to give you an overview, but I also let you know that I am available. Like I'm a resource in our community, and I'm here to talk to kids, adults, parents, professionals, um, together, separately. It doesn't matter. To do whatever I can to not only talk to folks about this, but set up systems that help support young people making healthy choices and quitting and all that kind of stuff. So I pause. What kind of questions do you all have? Let me stop sharing as well.
While folks are thinking about questions they might have, which you can also pop in the chat if you'd rather do it that way. I will just let you know that we're going to take the recording of this session. We'll put it on NMC's YouTube channel. We'll also share it out on social media. So if you have folks who maybe weren't able to attend today but were interested, you can certainly share it amongst anyone. We want to help spread the word about this, so we'll put it out there.
Okay. Well, then I'm going to summarize in my final minute and know that you can email me or call me with any questions. But these devices seem to be here to stay. They are wildly flavored and appealing in a variety of different ways to young people. And although we've proposed flavored ban restrictions at the Vermont level, it has not yet passed. But since about 85% or more of our students are using flavored, we know that it is a part of it. We want to do our best to help young people make healthy choices, and that means dealing with their stress, anxiety, and depression that they are experiencing it, and helping them identify that nicotine and THC may be causing stress, anxiety, depression as well. And that every adult has the potential to help young people to connect to resources to help them to quit. And if you need materials or promotions or a person, I'm here to help you. And I encourage everybody to go to mylifemyquit.org, sorry, and explore what resources are there for you. There's talking points and information. It's a really good resource.
Well, thank
Well,
you,
I'll say,
Amy.
yes, I
Thank
was going to
you,
say thank
everyone,
you.
for attending. We appreciate it. And just as a side note, we have another webinar coming up in June. It's on Thursday, June 8th. We'll hear from Robin Ayer, who is a certified nurse midwife at NMC, about midwifery services here. So if that's of interest, look for that information. We'll share it out to the community soon. I hope everyone has a great rest of your day. Thank you for being here.
Thanks so much for coming, everybody. Bye.
Thanks, Amy.
Yes, my pleasure.